Grapefruit, its vibrant color, tangy flavor, and refreshing juice make it a popular choice on breakfast tables and in fruit salads around the world. Rich in vitamin C, antioxidants, and fiber, grapefruit is often praised for its health benefits. But what many people don't realize is that this seemingly innocent fruit can pose serious risks when combined with certain medications, turning a healthy habit into a potentially dangerous interaction. To understand why grapefruit can be hazardous, we need to look at how the body processes medications. When you take a pill, your body uses a series of enzymes in the liver and intestines to break down the drug. One of the most important enzymes involved in this process is called CYP3A4. This enzyme acts like a gatekeeper, controlling how much of the medication enters your bloodstream and how quickly it's cleared from your system. Grapefruit contains natural compounds called furanocoumarins. These compounds have a unique ability. They can block CYP3A4 enzymes, especially those found in your intestines. When these enzymes are inhibited, drugs that are normally broken down quickly begin to build up in the bloodstream. The result is that you absorb much more of the medication than your doctor intended, which can lead to dangerous side effects, toxicity, and even life-threatening complications. This interaction isn't limited to just grapefruit juice. Whole grapefruit, grapefruit extract, and even certain related fruits like Seville oranges can have similar effects. The impact can be profound, and it can last for over 24 hours after you consume grapefruit, meaning that spacing out your medication and grapefruit intake doesn't always solve the problem. You might be wondering which medications are affected. The list is surprisingly long and includes some of the most commonly prescribed drugs. For example, many cholesterol-lowering statins, such as atorvastatin, simvastatin, and lovastatin, are metabolized by CYP3A4. If you eat grapefruit while taking these drugs, your body can absorb up to 5 times the intended dose, increasing your risk of muscle pain, liver damage, and even kidney failure. Blood pressure medications, such as calcium channel blockers like nifedipine and felidipine, are also affected. Grapefruit can cause these drugs to build up in your system, leading to dangerously low blood pressure, dizziness, and even fainting. Some anti-anxiety medications, including buspirone, and certain psychiatric drugs, like quetiapine, can also become much more potent when combined with grapefruit, increasing the risk of sedation and other side effects. Even some medications used to treat irregular heart rhythms, like amiodarone, are impacted by grapefruit's enzyme-blocking powers. In these cases, too much drug in your bloodstream can trigger serious heart complications. Immunosuppressants taken by organ transplant recipients are also at risk. Excess levels of these drugs can lead to toxicity and organ rejection. Antihistamines, pain medications, and drugs used to treat infections are on the list too. For instance, some antibiotics and antivirals, particularly those used in the treatment of HIV, can become dangerously concentrated, making side effects more severe and potentially threatening your health. It's important to note that not all medications are affected by grapefruit. The interaction is specific to drugs metabolized by the CYP3A4 enzyme. However, because the list of impacted medications is extensive and can include drugs for heart disease, cholesterol, anxiety, allergies, pain, and more, it's always wise to check with your healthcare provider or pharmacist. The effects of grapefruit on drug metabolism were first discovered in the late 1980s, quite by accident. Researchers studying the interaction between alcohol and blood pressure medications used grapefruit juice to mask the taste of the alcohol. They found that blood levels of the medication dramatically increased, leading to unexpected side effects. This finding led to further research, which uncovered the powerful role that grapefruit plays in altering drug absorption. Since then, warnings about grapefruit interactions have become more common. Many prescription labels and pharmacy instructions now specifically caution patients to avoid grapefruit and grapefruit juice. But despite these warnings, many people remain unaware of the risks, believing that a healthy fruit couldn't possibly be harmful. The danger lies not only in the increased potency of medications, but also in the unpredictability of the interaction. The amount of enzyme blocked by grapefruit can vary depending on the type of grapefruit, how much you eat or drink, and your individual genetics. Some people have more CYP3A4 enzymes in their intestines than others, meaning that the impact of grapefruit can differ widely between individuals. This unpredictability is why experts recommend avoiding grapefruit altogether if you are taking medications known to interact. Even a small glass of juice or a single fruit can be enough to cause problems, and the effects can linger for a day or more. Switching to other citrus fruits like oranges or tangerines, which do not contain furanocoumarins, is a safer choice. So, what should you do if you're taking one of these medications? The answer is simple. Always read your medication labels and talk to your healthcare provider. If your medication interacts with grapefruit, your doctor or pharmacist can suggest alternatives or offer guidance on safe fruit choices. Never stop taking a prescribed medication or change your dosage without consulting a professional. If you're ever unsure, or on the side of caution and avoid grapefruit. The risks of a dangerous interaction far outweigh the benefits of a tangy breakfast treat. For those who love grapefruit, there may be alternative medications that do not interact with the fruit, but this should be determined by your healthcare team. Ultimately, the story of grapefruit and medications is a reminder that natural foods, while beneficial in many ways, can sometimes have hidden risks. Our bodies are complex, and the way we metabolize food and drugs can have unexpected consequences. Staying informed and communicating with your healthcare provider is the best way to ensure your safety. In summary, grapefruit is a delicious and nutritious fruit, but it's not always compatible with certain medications. Its ability to block key enzymes can dramatically increase drug levels in the body, leading to serious and sometimes life-threatening side effects. If you take prescription medications, especially for cholesterol, blood pressure, anxiety, heart rhythms, or immune suppression, ask your doctor or pharmacist about grapefruit interactions. With knowledge and caution, you can enjoy the benefits of both your medications and your diet, safely and responsibly.